Close your eyes for just 1 second. Now swallow one time, slowly. Do you feel that thickness sitting in the back of your throat that never quite goes away, no matter how many times you clear it this morning? Most people reading this right now will feel exactly what I am describing. And here is what I need you to understand from the very first moment of this video. That feeling is not random. Your body does not do random. My name is Dr. William. And in my 15 years of practice as a primary care physician, I have worked with hundreds of adults in their 60s, 70s, and 80s who come to me carrying that exact same sensation. And here's what almost no one explains to you in a 1-2 minute office visit. That persistent mucus coating the back of your throat is not just a nuisance. It is your body trying to send you a very specific message. The problem is that most people, and unfortunately many rushed appointments, treat the symptom instead of listening to what the signal is actually saying. Today, I am going to walk you through 5 specific research-backed reasons why adults over 55 deal with this problem in a way that younger people simply do not. And I am going to tell you something that most videos on this topic never bother to say. 2 of these causes are almost certainly working together in your body right now at this very moment, because in my clinical experience, they almost always do. And when they combine, they make everything dramatically worse. I am also going to give you a practical action plan you can begin tonight with steps that cost you nothing and require no prescription. Before we go any further, I want to ask you one thing in the comments below. Is your throat mucus worse first thing in the morning, or does it follow you throughout the entire day? That single detail tells me a great deal about what is driving this in your specific body. Drop your answer down there. Drop your age too while you are at it. I read every single one. Now, let us start with the biology, because this is the part that changes everything, and it is almost never explained properly. Your body produces mucus every single day, around the clock, without stopping. That is completely normal and completely healthy. Think of mucus like the protective lining inside a water pipe. It keeps the surface from cracking, it catches debris before it can go deeper, and it keeps the whole system running smoothly. Without it, your airways would dry out, crack, and become vulnerable to every bacteria and virus you encounter. So mucus itself is never the enemy. The real issue is what happens to that mucus as we age. There is a system in your body called mucociliary clearance. Your airways are lined with millions of microscopic hair-like structures called cilia. Their job, which they perform millions of times a day without you ever noticing, is to sweep mucus upward and outward, keeping it thin and moving so it never has a chance to pool and accumulate. In a person in their 30s or 40s, this system is fast and efficient. Mucus is produced and cleared almost instantly. But research confirms clearly that as we age, those cilia slow down, the sweeping motion becomes less frequent, less powerful. Mucus that used to clear in seconds can now accumulate over hours. What this means practically is that any trigger causing your body to produce extra mucus will hit harder and last longer in a person over 65 than it ever would in someone younger. That is not a complaint about aging. That is simply physiology. And understanding it is the foundation of everything we are going to talk about today. So with that context in place, here are the 5 causes. I want you to listen closely, because I am going to tell you which ones tend to stack on top of each other. The first cause is one I want you to pay very close attention to, because the research shows consistently that this is the most frequently missed explanation for persistent throat mucus in this age group. It is called laryngopharyngeal reflux. You may never have heard that term, so let me translate it into plain language. Most people are familiar with heartburn, that burning feeling in your chest after a big meal, the classic acid reflux. But there is a quieter, more deceptive version of that same problem, one that produces no chest burning, no obvious digestive discomfort, and no warning signals that point toward the stomach, only a throat that will not settle down. Here's what happens. At the junction where your esophagus meets your stomach, there is a muscular ring, a valve. Its only job is to stay closed after you eat, keeping stomach acid locked in where it belongs. With age, that valve can gradually lose its tone, like a rubber band that has been stretched too many times. When it does not close completely, stomach acid rises upward, not just into the esophagus, but all the way up into the throat, the voice box, and sometimes even toward the back of the nasal passages. Now, here is the biological detail that makes this so significant. The tissues of your throat are not built to handle acid the way your esophagus is. Even the tiniest amount of acid reaching your throat triggers an immediate protective response. Your body rushes to produce thick mucus to coat and shield that irritated tissue. Pure biological logic. But when this happens night after night while you sleep, you wake up every morning with that familiar heaviness in the throat, and you have no idea why, because there's no heartburn, no chest pain, no obvious signal pointing toward your stomach. Research published in otolaryngology clinical literature shows that up to half of people with this condition experience no heartburn whatsoever. Only chronic throat clearing, a slightly rough voice in the morning, and mucus that begins building the moment they wake up. Ask yourself honestly, is your throat significantly worse in the morning than later in the day? Does it worsen when you lean forward? Do you notice a change in your voice right after waking? Those are the fingerprints of silent reflux. Let me tell you about someone I will call Margaret 71 from outside Columbus, Ohio. She came to me after 2 years of morning throat clearing that she had simply accepted as part of getting older. She had tried every lozenge and every home remedy. No one had ever asked her when it was worst. When I asked her to describe her mornings in detail, she mentioned she ate dinner around 8 p.m. and was in bed by 9:30. We made two changes, nothing else. We moved her last meal to before 6 p.m., and we elevated the head of her mattress just slightly. Within 3 weeks, she told me her mornings felt like a different life. That is the power of understanding what is actually driving a symptom. One additional note that deserves your attention. If you regularly take anti-inflammatory pain medications for joint discomfort, the kind available over the counter in that category of drugs, peer-reviewed research has shown that this class of medication reduces your stomach lining's natural protective barrier. That makes acid reflux, including the silent variety, significantly more likely to occur or worsen. If you take those medications regularly and your throat has been consistently bothered, please mention that specific connection to your doctor at your next visit and never stop a medication on your own. Bring this information to your doctor and let them guide the conversation. The second cause tends to arrive quietly and go unnoticed for exactly that reason. When people think of sinus problems, they imagine the dramatic version: intense facial pressure, throbbing forehead, completely blocked nose. But in many adults over 55, chronic low-grade sinus inflammation presents almost invisibly. Breathing feels fine, no significant headache, and yet the sinuses slightly inflamed and producing just a little more mucus than normal, drains silently and steadily down the back of the throat all day long. This is called postnasal drip. Here is the frustrating part. Many people dealing with this have been taking over-the-counter antihistamines for months, assuming it is seasonal allergies. And there is a reason that approach tends to disappoint. Antihistamines dry out mucus temporarily, but do nothing about the underlying inflammation inside the sinuses that is causing the overproduction in the first place. And dry, thickened mucus pooling in the back of the throat is often more irritating than the original problem. The approach with the most consistent research support is remarkably simple and remarkably affordable. Regular nasal rinses with warm saline solution. A 2025 clinical review published in the journal Medicina, analyzing evidence across a wide range of sinonasal conditions, concluded that nasal irrigation is an effective, safe, and low-cost strategy for treating and preventing upper airway conditions. It carries broad support from ear, nose, and throat specialists internationally as a complementary treatment. High volume saline rinses work by physically removing inflammatory mucus, reducing swelling of the mucous membrane, and improving the natural ciliary clearing function we discussed earlier, the very system that slows with age. The most important word in all of this is consistency. One or two rinses will give you a day or two of mild relief. Daily practice done correctly produces meaningful cumulative improvement. I will walk you through the exact method in the action plan. Now, cause number 3 is the one where I most often see surprise on people's faces when I bring it up in the exam room. Because when patients arrive and we start talking about what might be causing their throat to behave that way, their medications, the ones they have been taking faithfully for months or years, simply do not come to mind as a possibility. There is a class of blood pressure medications called ACE inhibitors, short for angiotensin converting enzyme inhibitors. These medications are prescribed millions of times each year. They are effective, well tolerated in most cases, and serve a genuinely important function. But they carry a recognized class wide side effect that research documents clearly. They allow a substance called bradykinin to accumulate in the body, and in a significant proportion of people, studies report between 5 and 20% of users, that accumulation causes persistent throat irritation and a constant urge to clear the throat. Crucially, this is not an allergy. It is not something unusual happening in your body. This is how the medication works, and it turns out your throat is sensitive to that particular effect. Here is the detail that makes this connection so frequently missed. The side effect can take weeks or even months to develop after starting the medication. So if you began a blood pressure medication 8 months ago and your throat started bothering you 6 months ago, you may have never connected those two events, but that timing matches exactly the pattern the research describes. A large scale study conducted with more than 27,000 patients found that adults over 65 were 53% more likely to experience this throat side effect compared to younger users. That is particularly relevant to the people watching this video. If you take a blood pressure medication and are not certain whether it belongs to this class, your pharmacist can tell you in under a minute, and if it does, there are alternative medication categories, specifically a class called ARBs, or angiotensin receptor blockers, that manage blood pressure equally well without carrying this particular side effect. That conversation is absolutely worth having with the physician who prescribed your medication. But please, never stop a medication on your own. Bring this to your doctor and let them review it with you directly. Let me tell you about someone I will call Harold, 7'8", from the Tampa Bay area of Florida. Harold had been clearing his throat so habitually that his wife told me it had become part of the background noise of their home. He had been on a blood pressure medication in this class for almost a year. When I asked him to write out a timeline of when the throat clearing had started against when he had begun that medication, the overlap was undeniable. We worked with his cardiologist to transition him to an ARB. Within 6 weeks, Harold told me the constant urge to clear his throat had decreased by what he called at least 80%. His wife confirmed it at the next visit. If you are still watching and this is landing for you, drop the word clarity in the comments below. That is exactly what this video is meant to give you. The fourth cause surprises people not because it is complicated, but because they dismissed it as too obvious to matter: hydration. But let me explain the physiology, because this is not what most people think. Mucus is composed primarily of water. Its consistency, whether thin and flowing or thick, sticky, and difficult to move, is directly tied to how well hydrated the surrounding tissue is. Think of it like this. Imagine warm maple syrup fresh from the bottle versus maple syrup that has been sitting open on the counter overnight. Same substance, completely different behavior. Your mucus works exactly that way depending on your hydration level. Here is the age specific wrinkle that makes this more than a simple reminder to drink more water. Research has clearly established that the thirst mechanism becomes significantly less reliable as we age. A younger adult feels thirst well before they become meaningfully dehydrated. In older adults, that early warning system is blunted. You can be dehydrated enough that your mucus consistency and your daily comfort are noticeably affected without feeling thirsty at all. Waiting for thirst to tell you to drink means you are always running behind, and chronic mild dehydration, maintained day after day, keeps mucus persistently thick and sticky, which amplifies everything else we have talked about today. A practical fluid intake target, widely cited in clinical nutrition guidelines, is approximately 30 milliliters per kilogram of body weight per day from all sources. Water, herbal teas, soups, and water rich foods all count toward that goal. But the behavioral key is deliberate, steady intake throughout the day, not drinking when you feel thirsty. This one costs absolutely nothing. A habit of keeping water accessible in every room you spend time in and drinking a full glass of warm water before bed and another before your morning coffee is one of the lowest cost, highest return changes I have seen older adults make. Costs less than your morning coffee to implement and begins showing results within days. Now, before I share the fifth cause and the complete action plan, I want to pause here for a moment because I know some of you have been quietly managing this for years without ever having had it explained this clearly. And I want you to know something. The fact that these five causes exist, that they are identifiable, that they respond to practical steps, means you are not stuck, you are not simply aging badly, you have specific, addressable physiology, and you deserve to understand it. I have been putting together a resource that goes well beyond what we can cover in a single video. If what we have walked through today has been useful to you, the link in the description and the QR code on your screen right now will take you to a complete guide I put together called the Complete Senior Health Vault. It covers the medications worth questioning with your doctor, how to use food as medicine for inflammation and energy, and a full manual for understanding your body after 70. Think of it as the conversation your doctor wishes there were time to have with you. Everything we started today, we continue there. And what I am about to share next, the fifth cause and the full action plan, is the most underappreciated piece of this entire picture. Do not go anywhere. The fifth cause is one that is rarely mentioned in videos like this, and I believe that represents a genuine gap. Because for a meaningful portion of older adults dealing with persistent throat mucus, the root of the problem is not in the throat, not in the sinuses, and not in the stomach. It is in the gut. Here is what the research shows. The digestive tract and the respiratory system share regulatory pathways through both the immune system and the nervous system. The health of your gut microbiome, the trillions of bacteria living in your intestines, directly influences the reactivity and inflammation of your upper airways. Think of it like this. Your gut bacteria are sending constant signals to your immune system, like a neighborhood watch committee reporting on conditions. When that committee is balanced and communicating clearly, the immune system stays calm. When it is disrupted, dysregulated signals go out. And one of the places that feels those signals is your airway lining. When the balance of gut bacteria is disrupted, a state researchers call dysbiosis, the immune system can activate responses that promote overproduction of mucus in the airways. Not because anything is physically wrong in the throat, but because the gut is sending inflammatory signals that the respiratory system is responding to. This connection, sometimes called the gut-lung axis, is an actively growing area of clinical research. Multiple peer-reviewed studies, including research published in the American Journal of Respiratory and Critical Care Medicine and the Journal of Allergy and Clinical Immunology, have confirmed that disruption of the gut microbiome can what trigger immune responses that promote airway inflammation. What disrupts the gut microbiome in older adults specifically? A diet low in fiber and fermented foods, repeated courses of antibiotics over the years, high sugar intake, chronic stress. These are not exotic factors. They describe the everyday reality of a large proportion of adults in this age group. Let me tell you about someone I will call Donna, 7'4", from the Phoenix area. Donna had dealt with persistent throat mucus for 3 years. We had already addressed her silent reflux and her hydration. There was still a residual issue. When I looked at her dietary history, she had been on 3 courses of antibiotics in 2 years for recurring urinary tract infections, and her diet was very low in fermented or fiber rich foods. We added a small daily serving of plain yogurt with live cultures and worked on gradually increasing dietary fiber over the following 2 months. The residual throat symptoms that had puzzled both of us continued to improve. The gut lung connection is real, and it matters for this age group more than most people realize. You cannot solve a gut airway problem with a throat lozenge, but you can begin supporting your gut microbiome through consistent daily choices. A small daily portion of a fermented food, plain yogurt with live cultures, kefir, a small serving of kimchi or sauerkraut. These choices begin to diversify and support the gut bacteria in ways that research associates with reduced airway inflammation over time. This is a long game strategy, not an instant fix. But long game strategies are what actually change your baseline. Before I give you the complete action plan, I need to take a moment that is genuinely important. In the vast majority of cases, persistent throat mucus in older adults is benign. It is exactly what we have been discussing today: manageable, addressable, and not dangerous. But sometimes the body uses symptoms to signal something that requires professional attention rather than self-care. Please make an appointment with your doctor promptly if you notice any of the following: mucus with streaks of blood, even in small amounts, on a consistent basis, swallowing difficulty that is gradually worsening, unexplained weight loss alongside throat symptoms, a persistent lump or swelling in the neck, a significant change in your voice that does not improve over time. These signals fall outside the scope of today's conversation. Please do not try to manage them at home. Bring them to your doctor. Now, the action plan. This is where everything we have covered translates into something you can actually do. Tonight, stop eating at least 3 hours before you go to bed. When you eat and lie down shortly afterward, your stomach is still actively processing food, and the valve we talked about has a much harder time staying fully closed. Remaining upright for 3 hours after your last meal is one of the behavioral measures with the strongest scientific support for reducing nighttime silent reflux. If you can have dinner by 6 p.m. and be in bed around 9 or 9:30, your throat will feel meaningfully different by morning. Also tonight, elevate the head of your bed slightly, not with extra pillows beneath your head, which only bends the neck and does not help the stomach. Instead, place a firm wedge under the head end of your mattress itself or under the legs of your headboard. Even a few inches of incline uses gravity in your favor and significantly reduces the amount of acid that can reach your throat during sleep. And before you go to sleep tonight, drink a full glass of warm water. This simple act supports overnight hydration and helps keep mucus thinner so that morning accumulation is less severe. Tomorrow morning, before your coffee and before breakfast, drink 1 to 2 glasses of warm water. This habit costs nothing. It immediately begins rehydrating your body and loosening overnight mucus accumulation before it has a chance to become a morning-long irritation. This is consistently one of the changes my patients report the most noticeable difference from. This week, pick up a nasal rinse device from your pharmacy, a nasal irrigation bottle or a squeeze bottle designed for this purpose. Use water that has been boiled and cooled to a comfortably warm temperature, not tap water directly. Add a small pinch of plain non-iodized salt and optionally a very small pinch of baking soda, which can help thin mucus by gently neutralizing nasal acidity. Use it once daily, preferably in the morning. Give it 2 full weeks of consistent daily use before you decide whether it is working for you. Consistency is what separates the people who say it worked from the people who say it did not. Schedule an appointment specifically to review your medication list in relation to your throat symptoms. Bring a written timeline. When did your throat symptoms begin? When did you last start or change any medication? If you take any blood pressure medication, ask directly whether it is an ACE inhibitor and whether an ARB alternative might be appropriate for you. Your pharmacist can also help you identify this in advance so you walk into that appointment already prepared. And remember, never stop a medication on your own. Bring this list to your doctor and have that conversation together. To begin supporting the gut airway connection, add one small daily serving of a fermented food to your routine. Plain yogurt with live active cultures, kefir, a small portion of kimchi, or sauerkraut. These choices begin diversifying and supporting your gut microbiome in ways research associates with reduced airway inflammation over time. Start with whatever's most accessible and most appealing to you. Consistency over weeks is what matters, not perfection on day one. Set reminders to hydrate. Keep water accessible in every room where you spend time. And add more whole water rich foods to your daily eating. Cucumber, watermelon, broth based soups, herbal teas. Your mucus will respond within days. A brief word on popular home remedies, because I know many of you have already tried some of them. Honey is genuinely soothing for throat irritation. It is not harmful and can provide temporary relief, but it does not address any of the 5 causes we covered today. Dairy does not create mucus out of nowhere. The science does not support that. However, some people find that dairy proteins create a sensation of increased thickness in existing mucus. If you notice a consistent pattern, a 2 to 3 week reduction trial is worth doing. Apple cider vinegar is a popular internet suggestion, but for anyone dealing with silent reflux, introducing additional acid into the system can make that particular cause worse. Please use caution there. Here is what I want you to carry with you from today. That persistent mucus coating the back of your throat has a reason. In fact, it has 5 possible reasons, and most people living with this problem have never had a single one of them properly explained. Silent reflux occurring quietly while you sleep without heartburn to warn you. Postnasal drip from chronic low-grade sinus inflammation that never announces itself dramatically. Medication-related throat irritation, specifically from ACE inhibitors, developing months after starting a drug with no obvious connection ever made. Chronic mild dehydration, just below the threshold that causes obvious thirst. And gut microbiome disruption sending inflammatory signals that the airway responds to. None of these require you to simply accept a life of constant throat clearing. Each one has a practical, evidence-informed response. And none of the first steps require a prescription or a specialist visit. They require knowledge, consistency, and the willingness to treat your symptoms as a signal worth listening to rather than a nuisance to be managed. Here is something I want to say directly to anyone who has ever been told that this is just aging. You are not simply aging. You are dealing with specific, identifiable, addressable physiology, and you deserve to know that. I also want to be transparent with you, as I always try to be. What we talked about today is health education, not a personalized medical prescription for you specifically. Everybody is different. Use this as the foundation for an informed conversation with your own physician, not as a substitute for one. The system, by the way, is not designed to give you this much time. A standard appointment moves fast, covers the urgent, and often leaves the persistent but not dramatic symptoms, like years of throat clearing without a real explanation. That is not malice, it is economics and time, which is exactly why I make these videos. Drop your age in the comments below. Tell me which of these 5 causes surprised you most and how long you have been living with this. I read every single one, and this is a real conversation, not a broadcast. And the next video I am publishing is going to go deeper into something I mentioned today that deserves its own full conversation. The gut and chronic inflammation, and how what is happening in your intestines may be quietly driving some of the most common complaints I hear from adults in this age group, from joint stiffness to brain fog to fatigue that sleep does not fix. That is a conversation you will not want to miss. Make sure you are subscribed and that the bell is turned on so you do not miss it when it goes up. Take care of yourself. You deserve to feel better than you have been settling